At the ASCO 2021 meeting, we presented data from the Upswing study. This is a real-world retrospective cohort study collecting outcomes of patients with rare EGFR mutations or rare and uncommon EGFR mutations. It's a large real-world retrospective global study which collected data on 246 patients with EGFR mutant non-small cell lung cancer with uncommon mutations. And these patients were treated with three types of inhibitors, first-generation EGFR inhibitors, treated with afatinib, and a smaller number treated with osimertinib. In summary, a total of 246 patients were recruited that we had data on. We split them into 5 different types of EGFR class when we talk about rare EGFR mutations. The major uncommon mutations, the exon 20 insertions, the T790M mutations, other, which is the sort of basket for everything else, and compound mutations, because many are seen together. What we identified is that the pathology reports are really very unclear many of the time. For example, in the exon 20 insertions, 72% of the insertions are actually unspecified or undefined. We don't know what the insertion type is. We didn't have that many patients treated with osimertinib, so we focused really on the outcomes of patients treated with afatinib and the first generation inhibitors. And when we look at the group corresponding to the major uncommon mutations, which is the commonest types of mutations we see, such as G76719X and S768I, we see a numerical advantage in time to treatment failure for afatinib at 11.3 months compared to 8.8 months for first generation inhibitors. So, the data does show that for this group of patients, EGFR inhibitors are active. The majority of patients that we had data on were receiving EGFR inhibitors in the frontline setting for these, but it's hard to make meaningful detailed differences between the different mutations because of the small numbers and the heterogeneity of mutations. But certainly afatinib looks very active in the major uncommon mutations.